Good evening and thanks for staying tuned. Welcome to our 9 p.m. segment of the COVID-19 special here on Channels Television. I'm Ladi Akiridoluale. Here are our highlights at this hour. Number of confirmed COVID-19 cases in Nigeria rises to 184. Federal government asks local manufacturers to collaborate in the production of equipment to track COVID-19. And COVID-19 infection numbers approach 1 million worldwide as United States death toll surpasses 5,000. We begin tonight with news from the Nigeria Center for Disease Control, which has today confirmed 10 new cases of COVID-19 in Nigeria. Of the 10 new cases, 7 are in Lagos and 3 are in the Federal Capital Territory. The overall figure of confirmed cases in Nigeria now stands at 184, with 20 persons discharged and 2 deaths recorded. A state-by-state breakdown of the cases showed that Lagos now has 98 cases. The FCT Abuja has 38, Osun 14, Oyo has 8 cases, Akwa Ibom 5, and there are 4 each in Edo, Ogun, and Kaduna states. Bauchi has 3 cases, while Ekiti and Enugu each have 2 cases, with Rivers and Benue states recording 1 case each. The Minister of Health today said the federal government will need the support of indigenous manufacturers in the manufacturing and supplies of some critical equipment, such as face masks, gloves, and ventilators, which are needed to effectively manage the spread of COVID-19 in the country. The minister was speaking during the daily presidential task force briefing on government's efforts to curtail the spread of COVID-19 in the country. Dr. Hanire also disclosed that the government is in talks with the Nigeria Medical Association on more assistance from their members.
Also expanded bedding and intensive care space in Abuja, Gwagwalada, and have urged all states to do the same in their states, starting with tertiary hospitals. All facilities, including all facilities where isolation and treatment of coronavirus are to be conducted will be inspected before accreditation by a team of experts that has been put together as announced yesterday. I enjoin all states and facility managers to cooperate in the exercise because it will largely determine our success in containing the spread of the virus. Yesterday, I had a meeting with the Nigeria Medical Association leadership, and they came to offer their cooperation and also to mobilize their representatives to be able to support the national response to the coronavirus threat. We have urged them to invite retired members, particularly in Lagos and Abuja, to register and volunteer their service. In view of the prevailing global shortages of particular commodities like masks and protective gowns and even of ventilators, we are going to have conversations with the Ministry of Industry, Trade and Investment to look for indigenous producers, indigenous manufacturers to try and support the effort to find more facilities and commodities that we are going to be using for protection and personal protection equipment.
And as if in direct response to the minister's plea, there has been some movement on the production of ventilators, as a matter of fact, repairs of ventilators, as 2 young technicians in Jos, the Plateau State capital, have brought their expertise into practice by resuscitating moribund ventilators at the Jos University Teaching Hospital. Considering the importance and usefulness of ventilators in the management of COVID-19 patients, it becomes pertinent for isolation centers to have functional ventilators in the treatment of such patients. With concern on how to effectively manage cases of infected persons, Williams Giang and his colleague approached the management of the Jos University Teaching Hospital with the intent of acquiring the scrapped ventilators for possible manufacturing of a local version, but eventually ended up repairing and bringing the respiratory machine back to life, with 2 of the machines now in good working condition.
Symptoms of COVID-19 patients actually is inability to breathe properly, which of course has to do with the respiratory organs. And of course, 2 young men have been around volunteering to repair the ventilators at the Jos University Teaching Hospital. Well, I have with me William Giang. How has it been handling this machine in this hospital?
Yeah, it's quite not easy, and it's very interesting somehow. You know, I wake up on the 23rd of last month. I was actually watching my television about the epidemic that is ongoing, the outcry about the coronavirus. And then people are saying that they need ventilators all over the country. People are just crying for ventilators. Yeah, I was like, what's this ventilators? What does it take to make a ventilators? Then I started making some research on ventilators. Then I was able to know the basic ingredients, what it takes for you to make a ventilators. This is my first time of seeing this. Even come close to the machine. I said, okay, they should on it, so that let me see how it works. So when they on it, I begin to see errors alarming everywhere. The machine is faulty. You know, there are 3 in number. So I was like, no, I think this machine can be revived. We can actually fix them. So I started working on it, and then when I started working on it, one of the staff at the ICU began to like, wow, it's like this machine is coming on. So he now give me an idea that the machine is coming on. It means it works. It can be fixed.
Well, his colleague that has been doing the repairs is Jibril by name. Jibril, you are a partner to William. How has it been fixing this machine?
Well, it has been so fantastic, I would say. Since we've been able to fix like 2 of the ventilators, we're still working on one, and we're going to get we will get it fixed.
We are trying them to see how it will last, but all the parameters that we need to show that they are functional as I speak now. So he has not fabricated one yet, but at least he knows what a ventilator is. And it's my belief that if encouraged, probably he can fabricate one.
The duo of William and Nura have their own intervention in repairing the ventilators here in Jos University Teaching Hospital. That means we don't have to go anywhere outside Jos or probably outside Nigeria to get some of these machines fixed, even as the government and the world all over are looking ahead to get a solution or a cure to the pandemic that is ravaging the globe. From Jos University Teaching Hospital, Yemi Kosoko.
Thank you very much, Yemi Kosoko, our correspondent in Jos, the Plateau State capital. Meanwhile, the Director General of the National Center, the Nigeria Center for Disease Control, Dr. Chikwe Iekwazu, has assured state governments that his agency will provide the necessary support during this period. He said that the NCDC has scaled up its capacity to conduct tests and produce results more quickly as Nigerians demanded.
Unlike other outbreaks that are localized, even the Ebola outbreak was still Lagos and Port Harcourt. This time, every day we add a new state. Every single day we have to deploy a new team. It requires resources, people, logistics, efforts. This is a significant exercise, and we're assuring every state that we will continue to do everything necessary to support them to respond to these events that are unfolding in our country. We're not doing this on our own. Every single federal government agency has offered us support, people, vehicles. Together, we are deploying these resources to the states. We rapidly train, we bring them into the team. It forms one federal government team. Both National Primary Healthcare Development Agency, the National Health Insurance Scheme, the Medical Laboratory Council, everybody has supplied staff and resources. with which we're deploying.
Dr. Chikwe Ihekwezu, Director General of the Nigeria Center for Disease Control. Meanwhile, President Muhammadu Buhari has directed the Ministry of Finance, Budget and National Planning to pay the salaries of federal workers and also ensure that critical infrastructure is protected. The president gave the directive at a meeting with members of the committee to review the impact of the coronavirus on the economy. He also asked the committee to, as much as possible, use local inputs so that the country retains value within the economy.
It's a two-pronged battle. Fight to halt the virus and to protect the economy. The world is faced with falling prices of crude oil. The implication is that the largest economy in Africa is hard hit. The president's committee to assess how much the pandemic is eating into the country's finances is at the villa with an update.
As you know, the crude oil price in the global market has gone much lower than the $30 per barrel that we had earlier on anticipated. So it means for us a further review on on the measures that we need to take. So basically, it's just to give them an update of where we are and what we need to do.
In spite of the obvious cash crunch, the president gave these marching orders.
His directive is make sure salaries are paid, make sure critical infrastructure projects like roads, rails are protected. As much as possible, use local inputs so that we retain value within our economy, and also make sure that you have measures that protect the poor and the vulnerable.
Meanwhile, Mrs. Ahmed and her team are members of the Economic Sustainability Committee, chaired by Vice President Professor Yemi Osinbajo. The VP's first task is to inaugurate the committee.
I'd like to just welcome you and say, without further ado, that we consider ourselves inaugurated and ready to go to work.
Before the meeting went into a closed session, Professor Osinbajo speaks on what's ahead.
Revenues have fallen precipitously. Of course, also domestic revenues have also fallen. So we're at a very critical and uncertain time in our economic history, and even in our history as a nation.
There are no immediate comments on the outcome of the committee's meeting. From the presidential villa in Abuja, Ibrahim Adra, Channels Television News.
Thank you very much, Ibrahim. Nigerians home and abroad are sharing their views on how Nigeria can successfully curtail the spread of the COVID-19. A clergyman is asking that government should look the way of agriculture to help Nigeria recover as soon as it wins the war against COVID-19. The senior pastor of Kingsway International Christian Center, the KICC, Pastor Matthew Ashimolo, told Channels Television that over-reliance on oil will not help the country.
Always screamed about Nigeria and the whole of Africa. We have a challenge of the absence of quality leadership, with all due respect. I respect my president. I celebrate my president. I believe he's a man of integrity. But leadership in general in Africa is very weak. We have big men, but we don't have great leaders. Number two, the system is weak. Once the virus hit here and they asked people to stay home here in the United Kingdom, the government rolled out a method for managing and even making money available to people so that their salaries are even coming from the government if they've been taxpayers before, not ordering somebody that he must pay his staff when there is no business. How do we learn from this? It is time for us to reposition, not focus on oil and gas. As you can see, the price has gone down. Reposition our agriculture. Food and Agric Organization says 60% of farmable land on earth right now is in Africa. This is the time for our government to push all of us into farming. Number two, human capital development. Did you realize that most of the hospitals in the United States of America cannot be sustained without those smart Nigerian brains? Matter of fact, when the news comes up on CNN and various places, many directors of the hospitals across New York, Texas, Delaware, everywhere in America are Nigerians.
And from there, we come back to our studios where I'm being joined by Dr. Titilope Charles Ermasele, who is a public health physician. Thank you so much for joining us this evening.
Thank you for having me.
10 new cases today, at least as at the time we're talking now, so bringing the total to 184. Do you think the lockdown, and of those 10 cases, 7 are in Lagos, 3 are in the FCT, 2 of the places that are supposed to be locked down, do you think that the spread is slowing? Because yesterday we had 23 new cases, and today 10. Do you have cause for optimism?
Yeah, the lockdown will suppress the spread of the virus. I think if we had not had a lockdown, we would have had more cases because we will be able to have community transmission and the chain of infection will not be broken if there was no lockdown. So with the lockdown, we've been able to limit the spread of the infection. So I think the lockdown, it's a good effort to restrict movement and enforce lockdown.
Of course, I ask everyone who comes in and sits where you're sitting about testing. We're told that the number of tests and so on is gradually increasing, and that may also be partly responsible for why we're seeing higher numbers of confirmed cases. Where do you think we are with the tests? Should we be doing even more tests than we are doing currently?
I think we should be doing more tests because with the tests, we'll be able to make diagnosis, to be able to detect the number of cases we have. You know, there may be some people who are asymptomatic, and if they're isolated and don't develop symptoms and they don't get tested, they could still contribute to spread the virus if they if they come out of isolation without being tested. So I believe we should, as much as possible, do more laboratory diagnosis, do more tests. Right now, we have like 7 centers in the Federation running tests. I think we should try to increase more laboratory centers that can do PCR diagnosis. The DG NCDC said earlier that we want to aim at running about 1,000 tests a day. I think it should be a good effort because if we can run tests, we'll be able to detect the number of cases so that we can limit the spread of the virus. Because if we don't test people who are asymptomatic people, they will continue to spread the virus. So we need to test as many people that come out with symptoms and are put in isolation.
Now, something disturbing came out yesterday because we received information, reports indicating that a doctor who was treating people in Edo State succumbed to this, so which brought to light the issue of the PPEs, the protective equipment for health personnel who are at the front line of this. From what you know, is the situation with that gradually improving?
I think the government is making efforts, but I think we need to make a lot more effort on this. The health workers need PPEs. They need personal protective equipment to work safely and effectively. If workers don't have PPEs, they will not be motivated to work. And then the safety of workers, you know, it's very paramount. If you continue to work without PPEs, you will get infected. And some doctors there's shortage of PPEs, and some doctors are clamoring that the government the health system needs to provide more PPE for them to work. So I think it's very essential that we have personal protective equipment supplied to all our health workers because it's for our safety and to curb the spread of the virus. Because if a doctor who is treating an infected patient gets infected, it will decrease the capacity of the health system. And also, it will also lead to more spread of the virus. So I think we should give more PPEs to our health workers.
I'm going to put you on pause. Then when we come back, I'm going to ask you about what can now be done by those who are not yet infected to avoid infections. But that will be after the break. Thanks for staying tuned. Welcome back to our COVID-19 special. And I'm still talking to Dr. Titilope Charles Ermasele. Before the break, I said I was going to ask you about those who are not infected. What can they do? It bears repeating. It will appear as if some of the major things have been said over and over and over and over again. But it bears repeating. What are these things?
Yeah, WHO has outlined like 6 steps, to prevent the spread of COVID-19 virus. The first is to avoid touching the eyes, the mouth, and the nose. And the second is to follow good respiratory hygiene. If you want to cough, cough into your bent elbow, or cough clean with tissue and put in a closed bin. And also, it's very important, maintaining social distancing, distance of at least 1 meter from a person that is coughing or sneezing. Also, it's very important for us to avoid shaking, hugging, or any form of contact. Also, it's very important to wash our hands. That's actually most paramount, washing our hands for at least 20 seconds with soap and water regularly, or using an alcohol-based sanitizer. That's very, very important, washing our hands regularly with soap and water and with an alcohol-based sanitizer. And also, it's very important that if we feel unwell, we should stay at home and call first. We can call our local health authority and alert them so that appropriate action will be taken. And then the last step is to avoid COVID-19 hotspots. The affected areas will avoid it, and also follow restriction of movement and other laws that are set laid by the government.
Well, there you have it. The good doctor has repeated it once again. We've been hearing this ever since this began, but it bears repeating because occasionally we still find people who are either questioning it or who are not quite complying. Now, let's find out from some of the parts of the country how this is going on. And first, we'll go to Edo State, where earlier in the day, Haslam Freedom sent in this update.
Earlier this week, the Edo State government placed a 2-week lockdown in the state. Tricycles, taxis, buses are banned from operating in the state, while motor parks and markets are to remain closed. Civil servants from grade level 1 to 14 are to work from home. These measures, according to the state government, are taken to stem the spread of the dreaded coronavirus disease. Here in Yola, the Edo State capital, the level of compliance appears partial, as perishable food items are being sold openly. Banks are providing skeletal services, and security personnel are busy ensuring compliance at checkpoints. As part of measures aimed at containing the spread of the virus, the Edo State government has acquired 4 ventilators. According to the state COVID-19 Compliance Committee chairman, there is no recorded case of COVID-19 in the state. Meanwhile, the state government has approved the sum of 500 million naira for the supply of relief materials to cushion the effects of the lockdown on the vulnerable. From Yola, Haslam Freedom, Channels Television News.
Thank you very much, Haslan, from Edo State, from Yola in Edo State. Move on to Kano City, where Nanchin Vincent also sent in an update on the situation with COVID-19 there.
Right here in Kano State, Yankura main market, where food items are being sold. Just on Friday, 12 midnight, Kano State government commenced the ban of interstate movement. There was a ban for around the bordering states, that no vehicles coming in with people or foodstuff or whatever should come into the state. And all of these are measures to curtail the spread of coronavirus disease in the state, even though Kano State has no record of coronavirus disease in the state. I am here in the market. However, there is a problem. Residents are lamenting the hike in prices. They are saying that it's becoming a usual thing with traders to increase the price of food items during situations like this. I'll be speaking now with some of them to find out exactly what the situation is here in the market. Madam, can you tell us what the situation is like, especially when it comes to the price of food items in the market?
Food items, they are very, very expensive now. They are very, very expensive now because formerly they were buying 1 mudu of rice for 1.2. But now you can see 1 mudu of rice now is 1.5. Gari that they are selling for 250 before is now 400, and the one of 500 they are selling it 700 now. So the things, in fact, many people are lamenting. And what I want is that if the federal government can come in and assist us, we'll be very happy. I'm very, very happy. They should please do something about it so that everyone will be happy.
As you have heard, residents are lamenting the hike of food items here in the market. Kano State is a commercial city, and it looks like everything is going on as normal. However, to cushion the effect, the food items, the price of food items is becoming a problem, and the government has to intervene. From Kano Commercial City, Nanchin Vincent, Channels Television News.
Thank you, Nanchin. And from Nanchin in Kano, we go to Owerri in Imo State, where Tokwe Kutei also has the update on happenings around COVID-19 in that state.
Good evening. For the third day running, the streets of Owerri are still deserted. This is following the directives of the state government on total lockdown of the state to prevent the outbreak of the coronavirus disease in the state. Today, the Commissioner of Police, Bolaji Fafora, led a team of other security operatives to monitor the compliance level in the state. And while briefing journalists, he says the people of the state still need to adhere strictly to the rules, regulations, and directives given by the state government on the lockdown in the state. He says only people on essential services will be allowed to move around in the state. He also called on his men to ensure that the assignment is done in the best civil manner and stopped the alleged harassment of citizens.
We've given them instructions, and we want to make sure that this instruction they understand and they are carrying it out to the letters. That is the main reason I'm out. If you find you in such a manner that you are not complying or you are not in the category of those people that are allowed to be on the road, we have to remove you away and ask you to go back home. In my state, we have briefed the men. They have to be civil in the nature of their duty. They don't have to harass anybody. They have to talk to them politely. If you don't have any reason for being on the road, you just have to be asked politely to go back home. That is what obtains in Imo State.
Okay. Even though Imo State is yet to record any case of the coronavirus disease, but the state government says it's not relenting in our efforts to put proactive measures in place in case of any eventuality. Tokwe Kutei, Channels Television News.
Thank you very much, Tokwe. So, we have 3 updates now: Kano, Imo, and Adamawa. And in each of those cases, there are no COVID-19 cases in those particular states as at now. When you take a look at those states or those communities that do not yet have any recorded case, as they are, many of them are under lockdown now. Is that effective in a situation where they don't have any recorded case?
Yeah, I think it's actually effective. It's a measure to suppress the spread of the virus, because I really don't know if there are cases, people in isolation in those states. They may still test positive, and if the states are not placed under lockdown, there's tendency for them to spread the virus. I think it's a means of suppressing the virus to ensure that there's restriction of movement and lockdown, so that those who are in isolation or cases that may be imported into that state will be limited, and it will be mitigated. The spread of the virus will be mitigated and suppressed.
Doc, please enlighten us again on what the things that we are not supposed to take are. Because people are trying, of course, very hard to take all kinds of medications to stop this. Some talk about garlic, some also talk about alcohol, actually. Some have also mentioned alcohol. Others have mentioned chloroquine. And if you go online, on social media, all kinds of doctors are recommending all kinds of things for people to use. Somebody mentioned sodium bicarbonate, and so I don't know what that is, but it doesn't sound very good, and it doesn't sound like something people should consume. What are the things that we shouldn't, as at now?
There are a lot of myths about COVID-19. this COVID-19 pandemic, and a lot of myths that people should take alcohol, take garlic and all that. There's actually no definitive treatment yet. A lot of clinical trials are still ongoing as to know the actual treatment, definitive treatment for this disease. Hydroxychloroquine and azithromycin, especially hydroxychloroquine, have been found to be effective in some treatment settings, but it has not been generalized. Clinical trials are still going on. And so basically, I think it's just supportive treatment that is being done for COVID-19 right now. So the case management is just to ensure that we manage the symptoms that present with the disease. So there's actually no definitive treatment. So the best thing is, as much as possible, we should make sure that we build our immune system, eat good food, healthy diet, rest well, and relieve yourself of every form of anxiety, and stay at home, stop the spread, and save lives. So it's better to stay at home and try to take the infection prevention measures that to be taken.
Now, I'll come back and ask you about something I read. It has to do with the passages, the airways, that mucus is part of the problem here, affecting the respiratory system of many of those who end up with COVID-19. Please think about that. But in the meantime, while the good doc thinks about that, let's go to South Africa, which is another country that has a high number of cases. And, of course, a large amount of efforts. South Africa's Minister of Health, Dr. Zweli Mkhize, has launched 60 additional mobile testing units to be deployed to communities across the country. This is in line with the government's plan to roll out a massive door-to-door testing, tracing, and medical management program. With more than 44,000 tests carried out so far, the number of confirmed cases in South Africa as of Thursday evening is 1,462, while 45 have recovered. Our South Africa Bureau Chief, Betty Dibia, reports.
Health Minister Dr. Zweli Mkhize launching the 60 additional mobile testing units added to the existing 7. Dr. Mkhize, addressing the media after the ceremonies, admitted that while thankfully the progression of confirmed cases may have slowed down because of current measures, the nightmare may be far from over, especially with the approaching flu season, a measure of non-compliance and increasing global transmission.
With the incidence of COVID-19 rising to more than 1,353, and of course we have had the figure today, COVID outbreak has moved from an important traveler-based outbreak to local community transmission, where the Department of Health remain concerned that the lockdown will not be enough.
Gauteng province, where you have Johannesburg and Pretoria, has over 600 confirmed cases, about half of the nation's total. Door-to-door screening and testing has already begun in Alexandra Township, with the Premier, David Makura, leading the mission.
We are starting in Alexandra for many, many reasons, one of which is because it's a vulnerable area. It's an area of high vulnerability because of the density, the number of people who live here, but also people are living, large numbers living together. Their household sizes are huge, but there's also vulnerability to incidences of poverty and hunger.
Khayelitsha, another township, this time in Cape Town, it also has a positive case confirmed. President Cyril Ramaphosa on Monday announced the next phase of the fight against COVID-19, which includes door-to-door screening, testing, tracing and medical management, involving 10,000 field workers. The goal is to get ahead of the virus.
People with symptoms will be referred to local clinics or mobile clinics for testing. People who are infected with the coronavirus but who have no or moderate symptoms will remain in isolation at home or at a facility provided by government, and those with severe symptoms will be transferred to hospitals.
300 proposed sites for quarantine and treatment have been marked for inspection in preparation for the worst-case scenario. It's 1 month after South Africa's first case was confirmed, and the number stands at more than 1,300. 31 people have recovered, and trials are in the works. 5 deaths have been recorded so far, and Minister Mkhize warns that that number could rise. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Well, the number of coronavirus COVID-19 cases worldwide has now gone past the 1 million mark as the number of deaths surpasses 51,000. According to the Johns Hopkins University, the Coronavirus Resource Center, even recoveries have risen higher, nearly 205,000. This comes as the United States reports more than 5,000 COVID-19 related deaths, while the country topped 1,000 COVID-19 deaths in a single day for the first time yesterday, accompanied by a new record job employment rate of more than 6.6 million. Meanwhile, in Europe, more than 10,000 people have lost their lives to the infection in Spain. And now let's take a slightly more global perspective. I've been joined via Skype from Grimsby in England by Dr. Ibrahim Bolaji, the president of the Medical Association of Nigerians across Great Britain. Good evening, Dr. Bolaji. Thank you so much for being with us at this time.
Good evening, Ms. Ayola. Thank you very much for bringing me into the program.
Now, in the UK, there are some rising figures, death toll actually, and from the reports that we have, there are also reports here and there of shortages and so on. Can you update us on what is happening in the UK?
Yeah, absolutely. It's a very sad time for us in the UK and globally, not only because of the pandemic of coronavirus, but when it has actually taken a member of our organization who is quite an important and eminent physician who volunteered from retirement to go back to work to be a victim of corona. It really hits home, doesn't it? We lost our member, Alhaji Alfa Sahadu, on Tuesday at 7:30, and he was buried today. I want to take this opportunity to convey my condolences to the family, to the wife, and the children. So coming to the issue about the UK, it's a reflection of what is going on around the world. Currently, we have identified about 33,718 cases. That's an average of about 4,000 cases a day. And at the moment, the recorded number of deaths is about 2,921 deaths. That's about 560 deaths a day. If you put that in perspective, we are talking of one death every 4 minutes.
Dr. Bolaji, I must sincerely apologize. I just want to put you on pause briefly. When we come back, you will continue your train of thought, but we need to take a break at this point. So please stay with us. Thanks for staying tuned. Welcome back. And we go back to our Skype conversation now with Dr. Ibrahim Bolaji, president of the Medical Association of Nigerians across Great Britain. Now, before we took that break, Dr. Bolaji, you were about to do two things. First, you were talking about this retired member of your association, Dr. Alfa Sahadu, who sadly passed away 2 days ago as a result of the COVID-19 disease. Could you tell us a little bit more about him?
Yeah, well, Dr. Alfa Sahadu has been an eminent member of our organization, and he has held so many managerial posts in the NHS. He has also contributed tremendously to his roots. For example, he was the chairman of the Kwara State Association of Nigeria in the UK, Kwasang, and he was probably the very first president. In terms of his managerial positions, it's just too many to count, but the most important ones are his position as the medical director and also the deputy chief executive in one of the NHS trusts. And he has also contributed tremendously to the country. For those that have met and known him, he was in Kwara State for a small spell of time in order to bring up some of the health sectors in Kwara State. And he has also made tremendous contribution to other parts of Africa.
Now, you also before the break, you were beginning to talk about the fact that there were shortages, and then, of course, there are other problems that are also being witnessed in the management of this COVID-19 in the UK. Could you please go on?
Yeah, okay. So if you look at the mortalities currently, it has been gradually rising. We're running at about 2,921 deaths across the 4 nations of the UK. England continues to be ahead with about 28,000 cases, of which there were 2,698 deaths, followed by Scotland, Wales, and Ireland. At the beginning of this, about 2 weeks ago, there has been a lot of problems about PPEs. There's a lot of protests from healthcare workers, from the supporters of the NHS workers, forcing the government to rapidly increase not only the production but the supply of PPE into the hospitals. Up till about 2-3 days ago, there's been a lot of crying from healthcare workers working at the forefront, particularly in the ICU, who have not been completely well equipped. But it will appear as if things are improving, but we are not there yet. There's still a lot of work to be done. As you'll expect, COVID is very unprecedented. Nobody has had any experiences before. And most of the guidelines and simulations in various hospitals has been followed by a lot of confusion. But things are getting better, but things are getting worse in terms of transmission and also in terms of mortality. It is expected that it will be peaking in the next 1 week or two. That is when it's going to reach the peak. And that is when all our healthcare system will be fully tested. At the moment, there's a lot of increased supply of PPEs and other equipments to the hospitals, headed by not only by the military, but by all the private sectors. There's been a lot of cooperation between universities and NHS sectors in inventing a number of ideas, particularly the issue of respirators. It's not everybody that require ventilators, but respirators might be maybe for those that doesn't require sedation. Respirators are easily produced, and they are working ahead to increase the number quite dramatically.
Thank you very much, Dr. Bolaji. We've completely run out of time. I want to thank you very much for joining us at this time on the program. Dr. Ibrahim Bolaji is the president of the Medical Association of Nigerians across Great Britain. Thank you so much for joining us from Grimsby in England. Thank you very much.
Thank you. Have a nice evening.
And indeed, on your screen now is the picture of Dr. Alfa Saadu, who Dr. Bolaji was referring to earlier, a prominent member of the Medical Association of Nigerians across Great Britain, who sadly passed on 2 days ago as a result of contracting the COVID-19 virus. He was 68. So, Dr. Erbasele, we have time for just one more comment from you before we round up the show. What would that be with relation to this virus? Could it perhaps be a piece of advice for those who are listening and watching?
I believe we should work more on infection prevention, trying to prevent the spread of the infection. We should follow strict guidelines by the government and by the World Health Organization. And we should work in line with what CDC is doing and NCDC is doing, and we should update ourselves with the correct information. We should not get carried away by myths and misinformation. And also, as much as possible, we should ensure that the health system is strengthened, because very, very important at this point in time, and getting more health workforce, our health workforce improved and increased, our number increased, so that we can have a lot of hands on deck. I believe.
Thank you very much. That would be it. Thank you so much, Dr. Titilope Charles Erbasele. It's been our pleasure having you with us on this COVID-19 special. And that's where we're going to wrap up this segment of COVID-19 special. My name is Ladi Akere-Doluale. Thanks for being with us. Tomorrow at noon and at 6 and then at 9, which will be around this time, please join us for more updates on COVID-19. And if you're at home, I was seeing some of the pictures during the course of the program. Do continue to send them in at hashtag COVID-19. Thank you very much and good night. My name is Ladi Akere-Doluale.